Welcome to the Psychology and Physical Training channel, Introduction to Sexual and Gender Identity Disorders. Have you ever wondered what it means when someone says they have a sexual or gender identity disorder? It's a topic that may seem complicated at first, but let's try to simplify it. Sexual and gender identity disorders are types of mental disorders that involve a range of experiences. This could be dissatisfaction with one's biological sex, the desire to be of the other sex, or conflict about one's sexual orientation or gender role. These disorders are not about choice, but about an individual's inherent feelings and self-identification. It's important to note that these feelings and identities are very real and deeply ingrained, not something that can simply be shaken off or changed at will. By understanding these disorders, we can foster a more inclusive and understanding society. We can help create a world where everyone feels seen, heard, and accepted for who they truly are. Understanding these disorders can help us become more empathetic and supportive of individuals who are dealing with these challenges. Delving into gender identity disorders, let's delve into gender identity disorders first. Gender identity disorders, now more commonly referred to as gender dysphoria, are conditions where an individual experiences discomfort or distress due to a mismatch between their biological sex and their gender identity. This is not about being transgender, rather, it's about the psychological distress that can arise from this incongruence. The symptoms of gender dysphoria can be diverse, varying greatly from person to person. Some individuals might feel a strong desire to be of a different gender, or they may believe they are the other gender. They might be preoccupied with their appearance, particularly during puberty, and may experience a strong dislike for their sexual anatomy. The causes of gender dysphoria are not entirely known. Some theories suggest it could be a combination of genetic, hormonal, and environmental influences. It is important to understand that this is not a choice, but a deeply ingrained part of a person's identity. Treatment for gender dysphoria is highly individualized and geared towards reducing the distressing symptoms. This may involve psychotherapy, hormone therapy, or in some cases surgery. The goal of treatment is not to change a person's gender identity, but to help them live comfortably with it. It's also crucial to note that societal acceptance and understanding play a significant role in mitigating the distress associated with gender dysphoria. Support from family, friends, and the community can make a world of difference in the lives of those dealing with this disorder. This discussion is a broad overview, and it's important to remember that everyone's experience with gender dysphoria is unique. Each individual's journey is personal, and their feelings about their gender identity can evolve over time. Remember, it's important to approach this topic with sensitivity and respect for those who are experiencing these issues. Let's continue to foster a society that acknowledges, recognizes, and supports all facets of human identity. Exploring sexual dysfunction disorders. Now let's explore sexual dysfunction disorders. Sexual dysfunction disorders, as the name suggests, are conditions that prevent an individual from enjoying or participating in sexual activity. There are four main types of sexual dysfunction disorders: sexual desire disorders, sexual arousal disorders, orgasmic disorders, and sexual pain disorders. Beginning with sexual desire disorders, or SDDs. These are characterized by a lack or absence of sexual fantasies and desire for sexual activity. It's as though the on switch for sexual interest is stuck in the off position. Often this can be due to hormonal imbalances, certain medications, or psychological issues such as stress or depression. Next, we have sexual arousal disorders, referred to as SADS. Here the desire might be present, but the body doesn't respond as it should. This could mean difficulty in achieving or maintaining arousal during sexual activity. The underlying causes can range from physical problems like heart disease or diabetes to psychological issues like anxiety or past trauma. Moving on to orgasmic disorders. This kind of disorder involves persistent or recurrent difficulty in achieving orgasm after sufficient sexual stimulation and arousal. It's as though you're running a race and just before the finish line you're unable to cross it. This can be highly frustrating and may be caused by various medical or psychological factors. Finally, we have sexual pain disorders, or SPDs. As the name implies, these disorders involve pain during intercourse. This could be due to physical conditions like infections or inflammation, or psychological factors such as fear or anxiety related to sex. Now you might be wondering, how are these disorders treated? Treatment can vary widely depending on the type of dysfunction and its cause. It might involve medication to address physical issues, hormone therapy for hormonal imbalances, or psychotherapy to address psychological or relational issues. It's essential to remember that these disorders are not simply about sex. They are about a person's quality of life, their relationships, and their self-esteem. These disorders can significantly impact a person's quality of life, but with proper treatment, individuals can lead fulfilling sexual lives. Unveiling paraphilia. Next, we'll unveil the concept of paraphilia. Paraphilia is a term used in the field of psychology to denote intense sexual interest or behavior that is atypical or extreme. It's essential to note that being different doesn't automatically warrant a diagnosis of paraphilia. For it to be considered a disorder, it must cause distress to the person or involve non-consenting partners. Let's delve into the various types of paraphilias. Some of the more commonly recognized ones include exhibitionism, voyeurism, and fetishism. Exhibitionism involves deriving sexual pleasure from exposing one's genitals to unsuspecting individuals. Voyeurism, on the other hand, is characterized by gaining sexual satisfaction from observing others undress or engage in sexual activities. Fetishism involves sexual fascination or fixation on non-living objects or specific non-genital body parts. The causes of paraphilia are complex and multifaceted. They may involve a combination of biological, psychological, and social factors. Some theories suggest that early sexual experiences or trauma can contribute to the development of these disorders. At the same time, others propose that certain brain structures or hormonal influences may play a role. Symptoms can vary widely based on the specific type of paraphilia. However, common signs include recurrent, intense sexual fantasies, urges, or behaviors that last for at least 6 months and cause significant distress or impairment in functioning. Treatment options for paraphilia also vary. They often involve a combination of psychotherapy, medication, and cognitive behavioral techniques. For instance, cognitive behavioral therapy can help individuals learn to control or eliminate unwanted sexual fantasies or behaviors. Medications, such as anti-androgens or selective serotonin reuptake inhibitors, may be used to help manage symptoms or reduce sexual urges. While these disorders may seem unusual or hard to understand, it's important to remember that they are part of the human experience and deserve our understanding and compassion. As we continue to explore and understand the complexities of human sexuality, it's crucial to approach all aspects with an open mind and a compassionate heart. Summary and conclusion. To wrap up, let's summarize what we've learned about sexual and gender identity disorders. In this discussion, we've delved into the complexities of these conditions, shedding light on how they impact individuals and society as a whole. Firstly, we explored the realm of gender identity disorders. We learned that these are conditions where a person's psychological gender identity conflicts with their physical sex. This can manifest as transsexualism, where a person identifies with the opposite sex, or as gender dysphoria, where distress arises due to this incongruence. It's essential to understand that these are not choices, but intrinsic aspects of an individual's identity. Next, we ventured into sexual dysfunction disorders. These conditions include sexual desire disorders, sexual arousal disorders, orgasmic disorders, and sexual pain disorders. They can affect any person regardless of gender, age, or sexual orientation, and can have profound impacts on an individual's quality of life and relationships. These disorders are often treatable, with options spanning from therapy to medical interventions. Finally, we unveiled the concept of paraphilia. These are intense and persistent sexual interests outside the norm. They can vary widely, from harmless fantasies to behaviors that harm others or the individual themselves. It's important to note that not all paraphilias are disorders. It becomes a disorder when it causes distress or harm. Throughout this journey, we've seen how these disorders can affect people's lives. The key takeaway is the importance of understanding and empathy. These conditions are not choices, and they don't define a person's worth or character. They are just one part of a person's complex identity. By gaining knowledge about sexual and gender identity disorders, we can challenge our biases and misconceptions. This understanding can help us to become more supportive allies, creating a more inclusive and compassionate society. Remember, by understanding these disorders, we can become more empathetic and supportive allies to those who are dealing with them. And if you like this video, do not forget to subscribe and follow the Psychology and Physical Training channel for more videos. Thanks for watching.